We would like to acknowledge the indigenous lands and the cultures of New York. We also acknowledge that our state and country were built through the labor of enslaved people with continued contribution through their survivors. We honor the land as the Creator intended and that we commit to keep it clean and support efforts to make it safe for all and not just some. We can show honor to the native keepers of the land by recognizing the value of their cultures and by learning the truth of their histories and how it provided the foundation for this country as we experience it today. We acknowledge labor inequities and our shared responsibility for correcting oppressive systems and our daily work. And hopefully, we can allow the learning to begin. Now, we want to get into the background for our special guest speaker. We are so gracious to have her in attendance and that she can make the time to help educate us and share with our community. Her name is Dr. Teresa Sue, and she is a licensed clinical psychologist and the founder and executive director of Speak, a supportive place for empowering Asian Americans and kin. We got a website link that we're going to share with everyone here because we're hoping that you can join the work that Dr. Sue does and share them amongst your networks. An organization committed to the mental health of Asian Americans, providing education, research, and services. Dr. Sue has a dual appointment as an assistant professor of psychiatry and pediatrics at Albert Einstein College of Medicine. And her research focuses on collaborative care, racism, and population health in marginalized communities. As a former assistant director of the Behavioral Health Integration Program at Montefiore Medical Center, she helped establish one of the largest pediatric integrated behavioral health programs in the nation. Her research has been presented nationally and published in peer-reviewed journals, and she is the author of the upcoming book. So keep your eyes peeled for this one, the Asian American Teens Mental Health Workbook, Skills for Children of Immigrants to Navigate Family and Cultural Expectations, Challenge Racism, and Celebrate Who You Are. Learning Cafe February, I ask that you give a warm welcome, put those icons together, those emojis, hand claps, and hearts for our special guest for this afternoon, Dr. Teresa Sue.
Thank you so much, Elijah. It is so wonderful to be here, and thank you for having me. I'm really, really appreciative. Am going to share my screen. Give me just 1 second here. And what I'd actually love to do first is have everybody introduce yourselves. If you can share your name, your role or organization, as well as the Asian ethnicities that you work with. I'm going to keep an eye on the chat so I can see how people are responding. And while you're doing that, as I said, and as Elijah introduced me, I'm Dr. Teresa Shu. For the visually impaired, I am an East Asian woman wearing a pink blazer. So I'm going to go ahead now, but keep those intros coming in the chat box. So as you all know, I will be really integrating Asian American culture and mental health. I've called this talk The Pain of Kung Flu, the Model Minority, and Jackie Chan, and you'll see as I touch on those points moving forward. First off, before we begin, happy belated New Year. It is a 15-day holiday that just ended yesterday, but I'm still wishing everybody a happy New Year. Just very briefly about me, I am a clinical psychologist by training. Elijah did such a kind job of introducing me. And as you all know, I'm the founder and director of a nonprofit focused on Asian American mental health. Just to briefly go over what I'll be talking about, I'll share some demographics and background information. I'll talk about those stereotypes, as well as the impact of these stereotypes and racism on Asian American mental health. And then I'll get into some of the practical information. So demographics and background. So I'll be honest, I think this is unfortunately some of the most boring material. It's also some of the most important. So I'm going to try to spice it up just a little bit. So before I get started, though, I did want to kind of define the population that I'm talking about. For purposes of this talk, I'm talking about the people with ancestry from these countries. Sometimes our group is called Asian American Pacific Islander. Some have referred to our group group as Asian Pacific Islander Desi Americans. And of course, the former White House referred to us as the Asian American Native Hawaiian Pacific Islander population. Um, One thing to know, I kind of use the census definition here. With Central Asia, there are some fewer similarities across cultures. And so again, for purposes of this talk, I'm just focusing on this more eastern part of Asia. Now, just a fun little quick question here. This is a very, 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 very diverse population. And one of the things that we look at when we're looking at diversity is language. So just to start you all off, how many officially recognized languages do you think there are in India? And just put your answer in the chat box. Officially recognizes languages in India. That's that red country over to the left. All right. I think you all know that there's a lot of diversity there. The correct answer is actually C. There's 22 officially recognized ones. However, there are over 1,500 languages in that one country. So you can only imagine how different people coming from these countries are and people with ancestry from these countries are. All right, so moving on here. Just talking a little bit more about the diversity and shifting back to Asian Americans. So the top three ethnicities in America are Chinese, Filipinx, and Indian. Sometimes there's more Indians than Chinese, sometimes there's more Chinese than Indian, but typically those are the top three ethnicities in terms of population in the US. Asian Americans are projected to become the largest immigrant group in the country by 2055. I know a few of you aren't working with that many Asians. I suspect that will change. If you just have one, immigrant migration occurs so that there's one family and then other people come join that one family and then suddenly there's a small community. So we can expect that trend to continue over the next years. Our next, ooh, my I must have hit an additional, and I already gave you guys the answer, but for anybody who did not see, what is the largest religious group for Asian Americans? And again, if you'll put your answers in the chat box. All right, so I got a lot of B's, some C's, some D's. All right, so if you guessed B, you are correct. It is actually Christianity. Buddhism and Hinduism are tied for third place at 11%, and actually about a third of Asian Americans have no religious affiliation. All right, now, one of the biggest things about Asian Americans is that it's a very bimodal population. So what I mean by that in terms of economic wealth is that we're both on the higher end, we're actually on the lower end as well. There's fewer people in the middle. So how many Asian Americans do you think live in poverty? And if you can put your answers in the chat box, that would be great. All right, so it looks like this is going to be a shocker for some of you. Um, the answer is actually A. 1 in 10 Asian Americans live in poverty. And those poverty rates vary very, very widely, very, very widely across Asian origin groups in the US. Yeah, that was a tough one, right? Many people don't know how bimodal this population is. But if we're looking at poverty rates, right? So all Asians, what the entire percentage of Asian Americans who live at or below the poverty line by origin group just 2 years ago, it's about 10%. But if you look up here, almost 20%, that's like almost 1 in 5 Burmese actually live at or below the poverty line, compared with about 6% of the Indian American population. So it really, really, really varies within ethnicities. I'm going to stop looking at the chat. So if people are, just because I don't have any more questions for a little bit, if people are responding, please don't think I'm ignoring you. I've just turned off the chat to proceed with the presentation. All right, so just a little bit more background. This is my last background slide here. Thinking about healthcare. So this is unfortunately a little bit outdated, just because I'm not able to get some more recent information. However, these statistics might be shocking to some people as well. So 25%, almost a quarter of Korean Americans are actually uninsured. So the national average for this, again, this is slightly old data. Back to the late, it's about 2019. 15% is a national average for the number of uninsured. And then in terms of people who did not see a doctor in the last year, adults, it's between 25 to almost 40%. And 40% are for Native Hawaiian Pacific Islanders. And this is the least amongst all racial groups. And I'll get into some of the cultural factors that feature in this as well. But as you can see from the poverty statistics, that can also be a factor as well. So there's no understanding the population without understanding the background. And I'm not going to go into like thousands of years of, historical references, but I do think it's important to know about, some of the selected recent history in the last century, especially if you work with immigrants or refugees. So some of these include like the Second Sino-Japanese War, known here as World War II, and the Nanjing Massacre, the partitioning and colonization of India, the Khmer Rouge in Cambodia, martial law in the Philippines, and there's actually multiple dates for this, and they just elected the son of the previous person who had implemented martial law, as well as the Gwangju uprising in Korea. And all of that has occurred in the last century, even if it's not for the people that you're seeing, the adults that you're seeing, it may be relevant for the seniors and also relevant for intergenerational trauma, which I'll talk about in a little bit as well. I'm going to move also to Asian American history. So one of the unfortunate pieces about Asian American history is that it's often taught in schools in the context of American history, right? So I was just talking about the Sino-Japanese War. It's known here as World War II, right? Anything related to the Vietnam War is from the Americans' perspective, as well as with Japanese incarceration and, for example, the colonization of Hawaii. I want to be clear that these are all selected, right? You could teach like 3 years of college courses on Asian American and Asian history alone. But I bring some of these up because they are really important for the populations that you're working with. Unfortunately, because they're taught in the context of American history, they're not necessarily focused on Asian American history itself. So for example, thinking about the resettlement of America, I'm sorry, of over 1 million Vietnamese refugees, or thinking about the long-standing impact of Japanese incarceration. So I will say that actually some Japanese have talked about being triggered with some of the mass deportations occurring now. So that's also something to keep in mind. Some of the some of the recent history that I think care providers just want to be a little bit familiar with in the last few years include the murder of Vincent Chen. I think of that as a little bit similar to an awakening that George Floyd brought on, but for the Asian community, because this was a racially motivated attack, as well as 9/11 and anti-South Asian hate, as well as, of course, COVID-19 with the anti-East, Southeast, and Pacific Islander hate. So briefly about racism and stereotypes. Again, I could talk about this forever, but I'm just going to mention a few things. So thinking about the last 5 years, Kung flu and what that did to a lot of our communities. In the 1 month following the beginning of COVID-19, there were 1,500 incidents. The violent assaults and verbal harassments increased by 150% in 2020. And then Asian Americans were actually more stressed out by racism than a global pandemic, if you can imagine that, right? So they're not even worried about they're worried about living in being alive in multiple situations here, but they were actually more stressed by the hate than by the global pandemic. Of course, people are likely also aware of the hate directed towards our previous presidential candidate, as well as the second lady candidate, the current second lady now. Um, I think also about invisibility when I'm thinking about what happens with racism. So historically, there's been the Chinese Exclusion Act of 1882 and the Asian Exclusion Act of 1924. They're pretty self-explanatory, basically excluding Chinese and Asians from coming into the country. One thing to note, so the psychology research is very weird. I don't mean bizarre, I mean weird as in Western, educated, industrialized, rich, and democratic. So if your research population is predominantly weird, right? So 80 to 90% is a very high percentage. And these people actually only represent about 11% of the global population. As you can imagine, these evidence-based interventions are evidence-based and validated on weird people, right? So people from Western, educated, industrialized, rich, and democratic countries. And so that's obviously not just an issue for Asian Americans. It's an issue for most people of color, right? Because this only represents 11% of the global population. So this really leads to an invisibility for the Asian Americans in kind of all fields. And this is really manifested in a survey that the Asian American Federation did last year. 52% couldn't name a single famous Asian American. 9% named the actor Jackie Chan, who's not American. He's from Hong Kong. Uh, in a similar vein, and unfortunately, again, this is not unique to AAPI. There's a hashtag out called Sorry Wrong Asian, and it's just full of people being called the wrong name. And media does it as well. Even as recently as Ali Wong's divorce from Justin Hakata, they showed a picture of her with Randall Park. They're not even the same ethnicities. One's Japanese American, one is Korean American. Below, that's Anna Mae Wong. All three pictures on the right are images that the media has used, um, attributing it to Anna Mae Wong. The woman on the very right is not even Asian. So that's to say there's a lot of invisibility. Please call people with the right name. All right, I'm only going to talk about one stereotype here, but this is probably the biggest one. What I would say about this is that it was a term coined actually to describe how Japanese Americans were incredibly hardworking and could essentially overcome adversity by being hard work and being dependent on family values and living by family values. Now, what this does, it really ignores heterogeneity and subpopulation. So I mentioned that bimodal distribution earlier, but the real pain and the real consequence is that there's a entirely resources are entirely misallocated. So an example is if anybody knows Utica, they have a large Burmese population there. And there was actually a case where a Burmese youth was shot by the police. And so they were looking for Karen speaking therapists because they didn't have any in the community. So that's an example of how resources are greatly misallocated because they're ignoring the heterogeneity in subpopulations. One other thing is thinking about Chinese Americans. In New York City, the most disenfranchised are actually the Chinese immigrants. The other thing about the model minority myth is that it stresses the population. So suicide is the leading cause of death for young Asian Americans ages 15 to 24. Leading cause of death. We're the only racial group to have this. So there's a real pressure to excel, particularly with our youth. Lastly, certainly not least important, is that this drives a wedge between AAPI and other minority groups. It makes an entirely flawed comparison, saying that you just have to work hard, and it ignores obstacles due to systemic and structural racism. So especially for my Black and African American friends and allies out there, this is entirely unfair to them. It's essentially saying, oh, two generations, or sorry, however many generations of Black slavery, oh, no problem, you can still work above that. Absolutely not true. And so this stereotype is extremely harmful, not just for Asian Americans, but for other minority groups as well. I'm going to talk about the impact on mental health here. I already mentioned that suicide has been the leading cause of death for young Asian Americans. What I also wanted to stress is this has actually been since 2017 and counting. It's been for at least 6 years. We just don't have the data for 2023 and 2024 to say that this has been going on till now, but I wouldn't be surprised, unfortunately. Another aspect, another important statistic here is that 57% of Asian American high schoolers reported being bullied for their race. AAPI are bullied at a higher frequency than any other race group. Unfortunately, you can imagine what that's like for mental health when they're targeted for something that they simply can't change. I'm going to take a pause from that and talk about some of the cultural beliefs that can factor into this as well. So one of the big things, and again, even though Asian Americans are very diverse, I kind of took three themes that are fairly similar across Asian cultures. One is collectivism, the idea that the society and community is larger than you are, right? So you're always putting them first. So in that sense, you always want to save face. You don't want to lose face. And this concept is really like public shaming, right? So if you do something as an individual, it reflects badly on your community. So I will, even share if anybody remembers the Virginia Tech shootings. That was kind of the first school shooting that received a lot of media attention, and that person was Asian. A lot of the Asian American community was actually very embarrassed about that. Another piece of this is that there's a huge respect for elders and they're very, very family centered. So oftentimes people will defer to elders for their opinions on things and not do things because the elders will not approve of it. So because of all these, oftentimes mental health is very stigmatizing. Again, if you're thinking about Virginia Tech and what that young man must have been going through, he didn't receive any help, right? Mental health issues don't exist. Now, let's say, okay, we worked through all of that and we did get somebody into therapy. Now what? Unfortunately, a lack of culturally and linguistically appropriate treatment and services results in early termination, right? And so all of these factors work together to impact Asian American mental health. Of course, we also have the statistics to show this. So Asian Americans are 50 to 60% less likely to have received mental health treatment as compared with non-Hispanic whites. And they are some of the least likely individuals to seek mental health care. All right, so with that background, I want to briefly shift to the intergenerational gap and talk very briefly about trauma. And again, these are also, this is also information I could spend hours talking about, but just to break it down a little bit, we think about the gaps that occur between parents and children. And this is not unique to Asian Americans, but that gap can be wider because of some of these components I've had listed here. So, for example, firsthand exposure to war, genocide, that refugee and immigration experience is often very unique. Of course, there's history related to the environment, exposure to racism in America. And of course, individual history as well, including poverty. Of course, all of those can bring on intergenerational trauma. I believe this group already knows what that is, but just in case, it's the passing on, quote unquote, of trauma, where the elder, the parent, or the grandparent is so traumatized by what's happened that they react to their current situation in a way that negatively impacts the child, right? So this might look like anger. This might look like abuse to a child. This might look like drug or alcohol use. This might look like anxiety. All right, so bringing chat box back up here, just to get into parents and babies. Which of these cultural practices do not occur? I'm just going to throw this out there to see what people know. And even if you don't know, totally fine. Take a guess here. All right, so I see a lot of D, I see some C, I see some A. Okay, great. So I just threw this in here just to talk about parenting practices in general. Um, there is a lot of authoritarian parenting, actually. And B is actually the correct answer here. It's not a traditional cultural practice, bathing the baby in rose water. However, rose water is actually very hydrating. If you've ever watched any historical Chinese dramas, you will see a lot of these noblemen bathing in water covered with rose petals. But that was a little bit tricky there. For C, the mother not leaving the home or washing hair for 1 month postpartum, it is a Chinese tradition that's often also done in some Southeast Asian countries. And the idea is that the mother has given it gives a lot of fluids leave the body once they give birth, and this 1 month is really to replenish and renourish the body. So you're also not supposed to wash your hair because they believe that when you give birth, the pores open, and if you wash your hair, then it actually lets in cold air. Sorry. So some families actually do practice that here. I've had some friends who practice this. It's called a 坐月子, and some people have practiced that. And after 1 month, they come out of the home. They have for Chinese people, a red egg ceremony where they, introduce the baby to the community, and it's a big party. Um, D, there's actually a very mild version of chai tea that some Bengali families give to babies. I'm not a pediatrician, so I can't talk more about the specifics, but I do know that oftentimes it's supposed to be very, very, very diluted, and that there have been instances where the babies are given too much tea, and of course that causes some developmental and functional issues like sleep, obviously because of the caffeine. Okay, so um, I started talking about some of the intergenerational um, differences between a parent and child. And, one of the things that I was trying to note in that last slide was, the parent and child may start off in the same place at birth, right? Because the parent is able to, do this 坐月子, or they may be able to feed tea to the babies, right? Because they are the parent and the baby has no other choice at that time. However, this gap often ends up increasing as a child gets older. So thinking about cultural dissonance is actually very, very, very common. It's considered actually normal with a lot of immigrant families where the parent is an immigrant and the child was born in the US. Because what happens is that there's disagreements in perspective due to this different cultural upbringing and the different cultural environment, and of course, language. They might be fluent in their language of ancestry growing up, and then once they go to school, they revert to English. Of course, again, I mentioned there's some differences because of uh, factors that occur in every family with technology, location, rural versus suburban, all of those things. But why am I talking about this gap in general, and why is it so important? So I like to think of immigrant families along Maslow's hierarchy of needs. When we think about the parent and the immigrant parent, Their focus is on safety and physiological needs, oftentimes, right? They're invested in employment, they're invested in air, water, shelter, many of these very basic needs, which makes sense given their history of being a refugee, poverty, genocide, war, trauma. So, what you may find, perhaps with some of the youngest ones, even. I know sometimes there are expectations. Why isn't my child talking at sometimes too early of an age? Or why isn't my child doing X, Y, and Z again at too early of an age? Right. But as that child grows up and as they become teens, what happens is that there's that cultural dissonance that I mentioned earlier. Right. Because what's happening is that the parent has provided all of these basic needs. So now what the teen is most interested in are these three at the top. So there's a mismatch in terms of what they need, right? And if you work closely with Asian American populations, sometimes there's like the running joke, like parents don't say "I love you," they'll just ask you if you want food, and so that does happen, especially amongst less acculturated and immigrant families. And sometimes for teens, all they really want is that actual phrase, I love you, because they've been Americanized to feel like that is how you show love versus recognizing that food might be a way of the Asian parent showing love. All right, so I'm mindful of the time. I'm going to move on to some brief practical approaches. So I saw a lot of people here were actually not therapists, which is great. And I'm really, really, really glad you're here because last year, the Asian American Federation did a survey of over 500 Asian Americans and asked, where do you go if you need mental health services or support? This is where people said, in terms of like social workers and therapists, right? This is way below all of these providers. So I'm really glad you're here because they're going to come to you before they're going to come to me. So very briefly, I'm going to talk just about Eastern and Western differences in care. I mentioned the collectivism versus the individualism and what that looks like when you're working with somebody. So again, the family's priority, whereas in the U.S., independence and self-reliance is more important. When you're thinking about mental health, you want to focus your intervention on acceptance of the environment coping with a stressor versus changing the self, right? Because then that gets perceived as a weakness in managing stress. Again, this ties into the idea of collectivism because what you're saying, if you have the problem, you should be changing, you've done something wrong. As opposed to recognizing, oh, there's this big stressor here. Even something like pregnancy, or even like something like figuring out how to welcome a new child into a home, that is a stressor and it's an environmental stressor. It really allows them to save face. I recommend a decrease of the emphasis on emotion expression. I know for a psychologist, we're always looking at affect, so how the person is looking. But there are some studies that suggest that there's actually a positive potential impact of emotion suppression for Asian American women. So it's not necessarily I grew up in the States, so I have a lot of emotion expression. So just because they are emoting less does not mean that they're not engaged. I also recommend a reframe of self-care. Again, if we go back to that collectivism idea, if you're focusing on the self, it's selfish. However, if you can reframe self-care as something that you're doing for your family or for your community, that might be a little better accepted. Of course, lots and lots and lots of social support as well. The general presentation, again, this really varies across cultures and across levels of culturation, but things to keep in mind that their body language could be a little bit more indirect. Their tone could be indirect. Again, they may be restrained in their emotions. If there are any providers who look at physical health, I would really recommend focusing on somatic symptoms because they'll tell you they have a headache or a stomach ache over feeling anxious or depressed. And then there's often a high power distance. You are the expert and not to be challenged. So they might not tell you what they're actually thinking of. Again, this is very much based on the individual and level of culturation and may or may not be what's actually happening for that person. But I do encourage keeping these pieces in mind. Thinking about increasing engagement and care. I already mentioned the attributing challenges to your context. I also encourage using biological explanations. Again, it's not because you're the problem, it's because your biology is wired this way, right? So your perinatal brain has imbalances that can cause low mood or anxiety. Again, this allows you to avoid the stigma of a personal weakness. I also recommend allowing the use of their own terminology. So there are some cultures who will talk about nerve weakness, right? So you might address the nerve weakness by increasing mood or energy by going through depression treatment, or addressing non-organic heart palpitations by focusing on breathing. Those sort of things helps destigmatize. It also encourages people to actually go through with the intervention recommended. So last thoughts so that we can have some time for questions. Um, the biggest takeaway is that Asian Americans are not a monolith. Please don't make assumptions. I really encourage everybody to take a client-centered approach to care, involve the family if appropriate, integrate traditional healing practices if appropriate. There is some good data that things like Tai Chi and yoga are really have evidence base for it and are really healthy for the individual and can also help with mental health, of course. And the biggest thing is, of course, practice cultural humility. That is true of any group that is not white. And it's especially true for a group as diverse as Asian Americans. So I'm going to stop here. And I'm going to look at the chat for any questions.
Dr. Shoops, thank you so much for this presentation. If anyone here with us presently has found that informative, just want to check in with everyone. Just throw your hands up, your hearts up. I've learned a lot of new things, and hopefully we can share some questions because we do have a few that are in the Q&A box. I'd like to apologize ahead of time if I'm not able to get to them all. And we'll start with one. So this particular question they're asking if you're comfortable, Dr. Shu, with sharing your personal experience or even a case example. Could you say something about the experience for first generation and immigrant children of having their feet in multiple worlds? Code switching doesn't quite capture it, but it's a complicated place to be, and the child has to make multiple accommodations and often feels on the outside wherever they are. So, kind of the social and cultural isolation from that.
Oh, that's a wonderful question. And it is actually normal for children of immigrants. And I am comfortable being very personal with this because I am a child of immigrants as well. And my upcoming book is actually specifically for child of immigrants too. You're right. It's not quite code switching. It really is, Stephen Yuen, the Korean American actor, has this great phrase talking about how he isn't really part of one world, isn't part of another world. He's kind of like his own third world. Um, and there's a degree of truth to that, where you are really reconciling different aspects of your identity. So I think it's a journey. It's not a single intervention. It's not a single conversation. It's definitely a journey. And what I really recommend, and I actually laid this out in my book as well, is figuring out roles because all of us has so many different roles. And for some children of immigrants, there's also a degree of parentification where you're taking on some of the things that your parent can't do, whether it's because of language or just navigating different systems. Um, it's about kind of taking those roles, taking your identity, and picking out the pieces that are going to sit the best and sit most comfortably for you. As part of this, I usually recommend racial pride because you can't change the way you look. But if you can be proud of that, then that will make a big difference in terms of your mental health going forward. I hope I answered that question.
I think that was a great offering towards that question. There's a question that kind of rolls right into that. It's and it has to do with identity. How can we help? So in the early care field, early childhood education field, how can we help Asian American youth celebrate their cultural identity while navigating the pressure of assimilation and also discrimination?
Wonderful question as well. It's extremely tough, and thank you for just being up for it and for answering this question because it is a weighty question. Especially with some of the social political climate now, and I really appreciate you asking that. I do really stick by, building racial pride here. There are things that they're exposed to that other people aren't exposed to in a really positive way, right? So, certain foods, certain customs. I'll be honest, my kids take off their shoes in the home, and guess what? My house is cleaner for it. But and I joke about that, but it is a little thing that I can take pride in. Um, and so, thinking about things that celebrate who they are, whether that is these small customs, whether it's holidays, whether it's food, whether it's going to the local museum and finding things that they connect to, whether it's reading a book by an Asian American author that really resonates with them, right? Finding people and finding situations that really resonate with them to build that cultural pride. I think that's a big piece of all of this. In terms of racism and microaggressions, it's interesting because I found that some teens are either really aware of this or some of them are really kind of brushing it off. And so sometimes even naming that it's happening can be a first step to figuring out what they want to do with that. Education around, hey, I understand that this can be racism, this can be microaggressions, and just being there to validate their perspective can be really meaningful as well.
Appreciate you so much. Um, Another question that we have, it says, I'm in the social work field, and at times when engaging Asian clients, the term flat effect is used, and I'm wondering if you're familiar with that term and if there's a better approach to take when met with this type of intersection.
Great question. And I am very familiar with flat affect. It is for anybody who's not in the behavioral health world, affect is used to describe basically how much emotion you're expressing through your face. And as I referenced earlier, I grew up in the States, and so I'm very expressive in my face. Unfortunately, I can't hide anything. Um, that being said, flat affect isn't necessarily a bad thing. You're really looking at other factors here, right? Is it flat affect in addition to headaches, stomach aches, complaints about relationships, poor sleep, poor appetite? Is it flat affect, but actually things are okay, right? So you don't want to take it, by itself. You want to take it in the context of everything else. I also wouldn't depend on affect to see how much somebody is improving because it could just be that they're culturally, that's part of their culture. That's part of who they are. But if these other things are improving outside of the affect, use that as a marker for improvement as opposed to solely depending on the affect. And I also assume if you're in the social work field, you've got your list of interventions that you can use as well. And again, if you're kind of basing it in these biological ways that can make interventions more accepted, and then also seeing what kind of things they're doing themselves already now that you can integrate into your treatment, so that there's a real integration and coordination of different methods of healing.
Appreciate your insight and being able to elaborate on that. It's just there's there's a couple more questions. Two I want to get to because they have the our Learning Cafe audience. They must have been reading into your bio and some of the things that you mentioned in your slides. So something came up about the book. It said, what inspired you to write the Asian American Teens Mental Health Workbook? And what are some key skills or tools you hope readers will take away from that?
Great question. You know, so just to get personal for a second, so I actually worked in the Bronx for almost a decade. And the Bronx population is near and dear to my heart. Um, During COVID, however, I actually felt really pulled because I didn't feel like I was giving back to my own community that was hurting. And so I actually made this total shift. And what I realized that I was getting back into Asian American mental health. is that there were a lot of my own experiences that are either named or not named. And, you can go to all these different sources to better understand it, but there's not one place to try to understand it and put a name to it and go from there. For example, just again to be very personal, so I have a distinct memory of being in my parents' garage after we had come home from somewhere. I was a teenager and my sister was a teenager, and she had turned to me and said that she wanted to kill herself. And at that point, there was no conversation about mental health. There's no such thing as a therapist at that time. And I have two young daughters now, and the creation of Speak was really out of, I don't want my kids not to know where to go. I want my kids to know therapy's okay. You can talk about your mental health. There will be somebody who will listen. And so both Speak and also the book is really coming out from those experiences. In terms of the book itself, one thing that I really stress, and I like this because I think it's non-stigmatizing, is an emphasis on values. And so everybody has a set of values, and if you can live by your values, it's much more satisfactory that way. And what I mean by values, it can mean kindness, it can mean wealth, right? It can mean wealth, it can mean love, it can mean compassion, it can mean trust. Whatever those values are. And I think teens are already developing those values. They might not be able to have put a name to it, but if they're able to say, okay, my family is actually, somebody I really, 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 really value. So if your family is somebody that is something that you really value, are you willing to always babysit your younger sibling, right? I mentioned the parentification before, right? Sometimes immigrant parents are working long hours in, restaurants, in gas stations, in wherever they are, right? Or even the parent who's working long hours in the ER, right? And so then the oldest child has to step up and babysit or cook or whatever else. But if your value is family, it makes that babysitting less stressful because you know you're doing it for your family. So really teaching and identifying values and figuring out how to work off of those values is something that I hope is a good message in the book, as well as cultural pride and racial pride, of course.
That's gonna be a great book. I can't wait. Please stay in contact with us to give us news and updates so that we can share it with our community as well. You touched on something that was great, and it comes from what you even mentioned in your slides. It was the idea of individualism and collectivism and digging deep into those values, those principles. One question, and also just to thank you for your transparency and your vulnerability, Dr. Shu, because it takes the embarrassment away from it. And then we can share these things. We know that we're not dealing with these very real and impactful situations alone. So just being able to, as a guest speaker, share with us your personal story. There were questions asking about some of your personal examples, and you went there, and we all appreciate you for it. The question about collectivism, to a degree, it says, can you share examples of how collaborative care models, like the one you helped establish at Montefiore, can better serve the mental health needs of marginalized communities?
It's a great question. I'm not sure I can answer this in the time we have left. That's like a entire, it's
I
entire
appreciate
course by itself. So actually at Montefiore, I worked in an integrated behavioral health program. I love the program. I'm still good friends with the director. I highly recommend it for anybody, who has clients in the Bronx. So what that means is that we were a number of behavioral health providers who, and they have a healthy steps program as well. So specifically for babies ages 0 to 5. And what they do is it's a bunch of behavioral health specialists sitting in pediatric offices. And so what happens is that the PCP may see a um, developmental issue, or maybe the parent has some trauma. Then they're referring them to the healthy subspecialist or to one of the behavioral health providers. And what's happening there is that it's very destigmatized, right? So what used to happen is a medical director would come down the hallway and say, "Hey, here's my friend Dr. Shu. She works with kids just like you." And then it's just another doctor in the office. You're not going to see a psychologist. You're just going to see another doctor, right? And so in that way is very destigmatized. It's also very accessible. There's not like long wait lists. There's not like you call somebody who calls somebody who calls somebody in order to get services. And I actually do have to plug their Healthy Steps program because, and it's one of the largest in the country, is that they see people ages 0 to 5, and they work with that dyad for the entire 5 years. And what they try to do is they meet with the family every time they come in for their PCP appointment, sorry, their primary care provider appointment. And so there are checkpoints to see how that family is doing. Again, totally destigmatized, very, very, very accessible. And those actually that actually fits into that collectivist model, because what's happening is that they're going to people within their own community, right? Provided that primary care provider is really just in their own community already. It's your regular doctor. And so it's not like you're shaming, there's no shame in your doctor talking to you about their other trusted doctor. Um, one of the things that Speak actually does is bring mental health into traditionally non-mental health spaces. So, for example, I did a pilot program and trained a Chinese speaking pastor. And again, the idea here is that, with this collectivist idea, you don't want to bring shame upon anybody. But if your pastor is talking about mental health, you can go to your pastor and you trust your pastor. It's a way to increase access while normalizing mental health. And I hope that answers that question.
I thank you so much. I know it's way more comprehensive, but thank you for what you were able to offer. I want to get just one more question in before we end, and my apologies to everyone who offered questions. It's not our intent to, look over any of them. Sometimes we get a lot of them and we're pressed for time. But the question is, how how would you suggest others who want to connect with the AAPI community do so? So and they mentioned a lot of like there were a lot of negative emotions behind things that are trendy. So like, all right, we had the TikTok ban. There was an alternative where people fell back onto possibly going to Red Note and just kind of having that, you know, trying to figure out what to do once something that was of convenience was challenged. But in order for us to not be that way and be a little bit more proactive, what are your suggestions on how we can stay abreast and stay in tune on what's going on with the AAPI community?
Oh, Elijah, that's a tough question. Um, the well, first off, I think just you all coming to this is really, again, really meaningful, right? You're just trying to learn about the community. I think there's definitely something just recognizing that somebody has a different perspective and trying to learn about that perspective. I think curiosity is always good. And sometimes Asians don't want to tell you what's going on because of that public shame. That being said, it doesn't mean you don't still ask or you're not still curious or you find a less threatening question. Food is always a good connector. Even the simple conversation about food or plans for the weekend, and if they say something that sounds different from what you might do, just learning more about that. But yeah, I think I lean on curiosity in this case. Curiosity, and thank you all for your interest and tolerance and willingness to be a part of understanding the Asian American community.
Thank you for presenting. So you hear that, everyone in our audience, being more intentional and actionable with the ask. If you're able to get introduced over media or food, can you ask the questions? Do you have the courage and the curiosity to take the conversation a little bit further? So we thank you all. Dr. Shu, thank you so much for your time, your dedication to your community, and just being able to share with us, everyone that's in attendance. We know that you have schedules and times and things to do. You will receive a prompt that is a survey. Please don't skip out on this prompt if you have the time to fill it out. It allows for us to be able to feature thought partners and community leaders and those that are educated like Dr. Shu to come and share with us. And we want this to be a step to many more people that can come and talk to us about the AAPI community and other communities. So if you have any suggestions, any connections, any things that you want to share with our Learning Cafe, please fill out that survey and stay in contact with us. And we thank you once again for joining us for the month of February. Dr. Shu, please be safe and enjoy the rest of your day.
Thank you. Same to you. And thank you so much for having me. Take care.
Absolutely.